The World Health Organization regards childhood obesity as one of the most serious global public health challenges of the 21st century. Jamie Oliver is on a continuing mission to improve children's health through better diet and increased activity. Our reporter caught up with him to find out more about his food revolution.
Jamie Oliver, thank you very much for joining us.
Pleasure.
Your crusade to reduce childhood obesity marches on, doesn't it? Congratulations on persuading the government to introduce a tax on sugary drinks. What specifically was it about that issue?
Look, I mean, good news is we got the sugary drinks tax. It's symbolic. It will show a drop-off in consumption. We got it hypothecated. We ring-fenced that money, and it's going to primary schools. So for food education, breakfast clubs, sports, amazing, right? But as much as I'm happy, and surprised, by the way, it was one part of, you know, hundreds of things that should have been strategized. I mean, it is a war. The actual childhood obesity strategy plan under Theresa's government, I think for a lot of people that are passionate about the belief that we can, you know, children are not put on earth to eat nuggets. You know, we've only got really ill in the last 30 years. This is absolutely an environmental issue. So one thing, like a tax, is not going to work. A couple of cute things, not going to work. A handful of brilliant things will not work. It needs to be an ambush, a strategy. It needs to be deep, and it needs to touch everything.
You've been very vocal in your criticism of the wider childhood obesity strategy, but the government might say, well, you know what, it's easy to be critical. What specific detail would you have liked to see in there to make it more robust?
What the plan said to me is no love. And to have the cheek to say that this is a world standard plan, don't talk to me about world standard plans. I spend my life travelling around the world more than any of that lot. I know what's world standard. If you want to know what's radical, go look at Chile. You know, and many countries that have to do stuff because they're so in trouble. You know, like Britain was and still is in a position to be a world leader in public health. But, you know, it's not a problem with the people in public health, it's leadership. We have no leadership in putting child health first. If child health was put first in every department of government, that plan would have been different. This country would be different, and we would be looking at the next 10 years with an incredible spring in our step.
Do you think the government could argue, though, that there's only so much they can do? They can encourage families to eat well, they can encourage parents to think about what they feed their children.
No, I don't accept it.
But there comes a tipping point where they're impinging on family life.
No. But basically, the analysis of ill public health, the patterns of diet-related disease, the correlation with that, and the growing of brands and big business and technology and freezer and processed foods. I mean, it's the most incredibly, fantastically clear bit of work. It's not rocket science. But really, you want to create an environment where we're in it together, everyone does their bit, and actually you can rise above and surprise us should you want to. And I think this plan does none of that.
Well, that's about root and branch reorganisation, isn't it? It's about education, it's about the NHS, it's not just about what kids eat.
It's everything about being British. It's everything about loving our kids. It's everything about the potential of looking after old people better. Like, if you cannot create an environment that is less obesogenic for the next generation, we cannot afford the NHS. I ain't no I can't even say economist, right? But we can't afford it. And I think, I guess the sad thing for me, or my true belief, is we will change. We will get there. Because we have to, right? That's not my debate, is will we? The problem I have is how late will it be?
And finally, Jamie, let's end on a high, because you are an irrepressible optimist. You do think that we'll get there in the end. What can organisations like the Royal Society for Public Health do in their campaigning to make sure we do get there?
I think these are wonderful organisations. I think they're, you know, they have depth and stability and expertise and trust. And I think they're really, really wonderful. And I think other than doing what they're doing already, I think collaborating with others other organisations, being timely, being proficient, using the same tools of marketing and PR and like precise timing, and being agile and quick to play companies as robust as a soft drinks company that do employ the best lawyers and the best marketeers and the best PRs. Like, we've got to try and get close to those guys. And I think, you know, what we're after is balance. We're not trying to win the war. We're trying to actually create an environment that has 50-50 choice, good and bad. And so I am optimistic.
Good.
But I think collaboration is the name of the game.
Jamie Oliver, thank you very much.
Thank you.
Good to see you.